The following question that I was about to ask you was, amidst all of these things and these experiences that you say nurses have, do you think nurses need counseling?
Yeah, they do. They're a lot. I think that is one thing that I'm, even where I'm at right now, I'm like with students that are nurses, they're doing short learning programs. And the more we teach, I'll teach and we discuss things, they're scarred, they're traumatized. There's certain things that they carry with them, and nobody goes back and say, oh, we're going to give you. I know most of companies like where I've worked, they have psychological services for the people, for the employees, but it's not always told.
Yeah.
It's not always given or rendered, especially because it needs to come from a management position level. When something happens, like a resuscitation happens, as a manager, you need to offer that counseling and be like, we're gonna get a psychologist to come in and counsel you, because people cry. I've noticed if the resources failed, we all cry.
Sure.
In fact, research, everyone cries. It's not a joke that you try to save someone's life. That's when you know that now I'm competing with God. I'm trying to fight with God right now. And you fail to do that. You cry. And then after crying, I don't think you'll be okay for the next 2 weeks. Sometimes it comes back again after a year. You carry that hurt within you because you don't know how are you going to displace it. That's another problem with being broken or being traumatized, is how do you displace that trauma? How do you take it out? So sometimes people take it home and they take it out on their families. Sure. It becomes an anger thing because you're more anxious, you're frustrated, you don't know what to do, you're guilty. Then you take it out on your family, you take it out on other people outside the work environment, and you find yourself changing. Because I think a nurse, from the time of training till now, I'm sure you have changed. I'm sure you see life differently.
Yeah.
It's like the way I see death is so weird. Death does not move me. It's like even when someone says someone has died, I always want to know what was the cause of the death. Then I'm like, shame, man. They were not going to survive that. So you ask yourself, but what makes me to disconnect? But when there's a patient that I take care of, they die, I cry. But when someone that probably I even know, they die, if I know the cause of the death, I'm like,
it's one of those. It is what it is.
So maybe I'm displacing my trauma and be like, there was a reason behind it. So nurses need counseling.
Do you think they would go for such services?
I think they will.
Or out of fear of stigma?
If they are offered to them, they will.
Nurses,
because they know they're there.
Yeah.
Every employer has those services for their employees. But the question is, how is it how do they disseminate that information? Sometimes when you're doing orientation, you're told that, we have psychological services. But then I noticed when I worked in the private sector, they literally take the initiative to call for you. That someone calls you. Because I remember when I had COVID, I had COVID last year. The first thing my bosses did, they called those services for me, and then they informed them that I had COVID, and those people called me. Those psychologists called me to ask me how I'm doing. How am I feeling? Am I having symptoms? Is everything okay? Do I need support? If I do, they gave me a number that please call back on this number. And for me, that was profound. I was like,
someone gives a...
Wow, someone cares. So I noticed that it came from my manager. Then they call those services, and then you get the support.
In Para, something like that. There's no such.
Para is a trauma zone. It's like, Dad, move on, next patient. You move on very quickly, and they're all like, shame, shame. It's all forgotten. After 4 hours, it's forgotten. We know that someone died, but we have to move on. There's another patient. But nobody comes back tomorrow and be like, how are you feeling after yesterday? I heard that you had scrapped for this case, or you were involved in this case. How are you guys feeling?
Earlier this year, I lost 6 patients in a period of 7 nights.
Wow.
So from Monday to Saturday, I had lost a patient.
Wow.
That was the first time ever in my whole career that I actually lost so many people. I was working night shift since we work 7 days. when my night shift started, I lost a patient the following day. So out of 7 nights, 6 of those nights, someone died.
That's horrible.
It's scary.
That's horrible.
But the thing is, I'm asking myself, if someone was to say we have counseling services, would I go?
You might go. You might. Because I think with nurses, we taught psychology and we know what counselor can do. I know we think we know what they're going to ask us and we want to respond in a certain way. I once went for counseling and once, I don't even know why, I think I was still at varsity. I think I was in first year. There was a time I went for counseling and you're thinking the goal.
Tell them to reduce the volume, that's it.
The goal of counseling is weird. It's your goal. Because sometimes you're thinking that they're going to solve your problem. No, you need to allow counseling to happen. So you need to understand what counseling is all about. Because they're going to start asking you about your childhood. And that moment I realized, like, there's so much I don't want to talk about in my childhood. So I stopped counseling.
Yeah, and once you say, okay, I'm not ready to tap into this.
Exactly.
That disrupts the whole counseling process. Okay.
And if you're vulnerable enough and open enough, so let me discuss this childhood. And it was so funny is I stopped it. I was like, this is not going to help me. I don't want to talk about my childhood.
I mean, how is it going to help me right now? I'm having problems now.
And only to find out on my own, I started tapping into my childhood myself. And you realize that actually you're a broken child. You were scared into tapping into the skeleton, that horror, that, you know, that horrific. You remember when you're growing up as a child, you don't know what you're going to become. You don't know what is going to shape you to becoming the adults that you want to be. And sometimes some things that you think, there's things that you think were wrong. And there's things that you think you escaped. So when someone starts tapping into that, you don't want them to you don't want them to go that route because you don't think that's the problem that is being caused now. The problem now is what I'm facing. It's not what happened in my childhood. And you'll be shocked that it's actually stemmed from your childhood. It's stemmed from that childhood that is why, you know, you're behaving the way that you're behaving is because that child keeps on wanting to come out all the time. They keep on. So counseling is, you need to be ready to be counseled. You need to be ready to go back to childhood for us to make that child, maybe that 6-year-old, to grow up and meet you halfway or meet you where you are right now. Because there's so many years that child needs to recover. If you're broken at 7 years old, you need to allow that child to grow. If you're forgiving that child, you need to forgive that child and say, I'm allowing you to grow. I'm forgiving you. It was not your fault. You could not protect yourself. You could not do anything. So I'm allowing you to grow. Don't beat yourself about it. You are successful now. You grew up. You overcame those problems. But look at where you are. Because that child always comes back. It comes back even in your relationships, in your friendships, in your marriage. There's always going to be that child that wants attention. Because that child was not given that attention. Yeah. Until the child is addressed or apologized to, your brain settles. That memory fades. You grow. So I think as nurses, we're scared to face that person that was broken somewhere. Because psychologists, they start from the beginning, I'm sorry.
They don't do shortcuts.
They will never start from, I had a car accident, I'm traumatized. No. They start from your childhood.
So that injured child needs to be addressed. You know, speaking of injuries, you're doing your master's now.
Yeah.
Right, and your topic has to do with injuries, moral injury. Moral injury. Well, what is that, and why injuries?
Do you know? How do I even explain it? Like from the time that I started nursing, I've always had this beautiful attraction towards ethics. I've always thought that ethics makes sense to me. It's one thing that I want to discover. As long as I live and I have to do research, I want to go deeper into ethics. I want to go deeper into the importance of ethics, especially in nursing, especially social sciences, anything that has to do with a person. Ethics is the most important thing. and also discovering the difference between ethics and morality. I think that's where people get it wrong. Morality is about bad and good.
And ethics
stands out because it's about the good.
Maybe
Only.
Maybe this is how I should start it, because I remember what Professor Downing said. You need to define your terms so that there's no confusion throughout the whole conversation. What are ethics? What is moral? And what is an injury in this conversation, in your study?
So my study, that's what I'm saying, morals. Morals is knowing what is good and bad.
Okay.
So morals, knowing what is good and bad, it can be, there's a little bit of ethics embedded in it. The good that is in morals, that's ethics.
Okay.
So in ethics, it's all about doing good through and through. It's about the beauty of good.
Okay.
So ethics have no bad unless it's unethical.
Unethical. So once it's unethical.
So when I'm saying you're ethical, I'm saying you are abiding by all the principles of ethics. All of them.
Which are?
Your justice, your...
So you're fair.
You're fair.
Okay.
Beneficence.
You're beneficial.
And malneficence. Malneficence. Oh gosh. Non-maleficence.
Not harmful.
Yeah. Not called doing harm. And also your... autonomy, respecting that self-determination, that decision. So, and it becomes a guide of everything in nursing or in healthcare, or whether it's, because research is based on ethics, because you can't just do things on humans just like that. You need to be ethical in every step of the way of your research process. So then with moral injury, it's a topic that I stumbled upon, I don't want to lie. I had one I could say my mentor, Dr. Ida, she actually gave me an article and was like, I was doing my research and methodology in 2020. She's like, please read this article for me. I wanna do research on this. Actually, she wanted to do a program, a study. Then I read it, I'm like, no, I love this. Can I have it as my master's topic? I love this term, because I'm doing something on ethics right now. I wanted to introduce ethics education, but then I'm like, I love this term, moral injury. I think it will resonate with what I want to achieve, It will resonate with what I want to achieve because I love ethics. So I'm still trying to find myself, what am I going to do in ethics as a study? So moral injury was like a term it's a military term. It's a term that it's not even a military term. It was started by psychiatrists and psychologists that studied military veterans in Afghanistan. So there were people that they could not identify as post-traumatic stress disorder, depression, anxiety, what else? I think those terms. So they did not have those symptoms, but they had one significant thing. They kept on saying, I'm guilty, I'm feeling shame, I'm asking if God has forgiven me with what I've seen, what I've observed. So this is when you observe a transgression that is being inflicted by a person of higher authority, where maybe it's your supervisor or whoever is above you. They inflict harm on a person. And then you start questioning your morals. You start questioning your values. Who are you on this earth? What happened and what you observed, was it the right thing to do?
To observe.
And then the question is, why didn't you do anything about it? So you failed to act.
So that guilty comes from,
yes,
I did not act.
I did not act. And now it's coming from a person of higher authority. There's so much influence there. This is a person you're modeling. This is the person you look up to. And you know very well deep down in your heart that was wrong. So I decided to take moral injury because after COVID, that's when a lot of healthcare professionals started saying, you know what, there's so many things that our employers are doing. We know they have PPE. There's no space in the hospitals. We are suffering. We are resourceless, but this patient is the one that suffers. And we have to observe
the employer.
And there's nothing we can do about it. There's nothing. But this patient looks at me and hopes that I can do something, but I can't. So the person above is failing me. They're transgressing on this patient, and I'm looking. I can't do anything. But I carry that guilt with me every day. Because I know with my pledge, this is the quality care I'm supposed to render. I don't have the resources. So it's in many ways. Sometimes it's not even about the resources itself. It's about what do you observe in clinical. Because as a student, I've observed this is going to be bad on my colleagues, but I've observed it, that nurses will shout at a patient like so badly.
I've observed a nurse pushing a patient.
I've seen a nurse slap a patient.
Labor ward.
A
labor ward. Whose sister I'm not gonna name her. She actually slapped that young girl to open her legs.
Yeah.
Told her to push the baby or leave my labor ward.
Yeah.
It's either you're gonna push this baby out or you get out.
I've seen patients being slapped. You see a lot. You see a lot, and you just sit there. You're thinking about your register. This is the person that has to sign my register when I leave today.
How do I tell them that this is not right?
How do I tell them that I did not like what you did? It was wrong. You shouldn't have done it. Where do you even start as a student? So that was my question. That was my research question. If there is moral injury, and if there is, what are the effects towards the student?
Because so your focus is on students?
Yeah, my focus is mostly on students. Because it was more like it hasn't been discussed as yet. And everyone is focusing now on healthcare professionals post-COVID. How did you feel? And yes, they're coming through and saying they did feel it. They didn't have that guilt of having to choose who goes on the machine and who doesn't. Who needs the machine? The resources are not there. Now, you have to live with the fact that there is someone that came in and had to be prioritized on that vent. And how do you take home that guilt, that shame, that those feelings of questioning God and be like, was God there? Is God forgiving you of that action that you failed to act?
I mean, one of the roles of us as nurses is that we're supposed to be advocates.
Yes. And now, because of that role and because of that pledge, you can't do anything. And you know that role and pledge makes you feel guilty. That is where the feelings of guilt come from. You will be guilty for the rest of your career or life because you know what is right. Moral injury is about injuring your morals, your beliefs that you've known all your life and what is right, and your pledge in your professional practice, legal practice, and it's not being done. And you just observe.
What effects do we get? What are the long-term effects of, in first year I'm seeing this, in second year I'm seeing this, in third year I'm seeing this, in fourth year I'm seeing this.
Yeah.
What are the long-term effects?
Well, that is where I think most researchers are at. They are trying to look at the whole idea of this is where burnout comes from. Because I think the other terms that came about when they were trying to differentiate what moral injury was burnout. Because that could be the one thing. Because when they were studying burnout, moral injury also popped. That what exactly causes you to feel like
I don't want to go to that
I don't want to go to that place. I'm tired. I'm not motivated. I'm not feeling like going to work. What exactly is going on? Then when you question, guilt always comes up.
Because I feel guilty.
There's certain things that you don't have control of that come up all the time, frequently. So burnout, depression, anxiety, and all that. So now we want to separate it as a syndrome on its own and be like, let us address those guilty
thoughts.
Those guilty thoughts, that shame, that anxiety that is caused from observing that transgression. What can be done? You know? So I think at a student level, for me, my vision is to go to a point where I'm like, we have ethical competency courses. We have moral competency courses. Are the students competent enough to go and deal with ethical dilemmas post-graduation? That is the question. Are we teaching them enough ethics to make them stand up for themselves, to make them strong and say, that was wrong and I'm done? And I feel like that whole thing influenced me throughout my career because I hated not having that power as a student, that I became that nurse that was like, if I'm going to correct that one wrong, I will correct it.
Well, I think we did correct it in third year.
Yeah.
With that lady.
We were harsh.
You think that lady was trying to injure us morally?
That's the thing. But I think when we got to third year, we were very strong. we could stand up for ourselves. We could be like, this is wrong, and we're gonna stand up for it because you were wrong. So it's one of those things that you like, how does it change? Some people leave nursing because of that. They're like, you know what, I'm done, I cannot do this.
If this is what nursing is about,
I'm gonna leave. And there's another study I think that they did in China where they're actually finding that is the cause of why people are leaving nursing. It's such experiences where they don't see care being done to a patient, and you're like, who are you to come into this ocean and think you're gonna change?
maybe the reason we are struggling to change as nurses, it's because when you qualify, we qualified from our group, it was only 22 of us. We go into this ocean and this pool of nurses that are used to doing things a certain way, which may be unethical. And because it's just me and Nollen from UJ, and I'm scared to challenge these people, I'm scared to show how assertive I can be, then I just get swallowed into this ill and vile behavior of nurses. Maybe that's why we're not gonna see any change, and the stigma that stigma and reputation that nurses have, it's not going to change anytime soon. What have been some of the things that I don't know if you started collecting your data already?
Yeah, I did. I actually collected my data this week.
What has been some of the common responses that students have been witnessing and they've been scared to?
I really haven't looked into it. I just collected it, and I wanna, because I'm still left with other questionnaires. I wanna see what is the common thing. I haven't gone deeper into even looking at their responses, because I wanna do it all at once and be done. But when they did my pilot study, it's like there was one question that really stood out for me, that every time when there's a question under moral injury where they ask, have you ever seen or witnessed something, a nurse that you work with or staff member doing something wrong to a patient? And all of them, they agree.
So it doesn't specify.
No one even goes neutral. They agree. And then there's that other question that says, do you think God has forgiven? Do you question God's forgiveness? If God has forgiven you for that, for observing that? And they do agree that they do question that. To show that it happens across nursing. We see these transgressions, and there's factors that, as I was saying, from a student level, this person is going to sign your register at the end of the day. This person holds your qualification. If you do try and fight back, they won't sign your signet, they won't sign your register. So it's very scary that you're like, now what do we do as nurses? If this is what is happening within us, within the nursing community, do we teach them to advocate for the patients? Or do we go back to the transgressors and ask, why are they doing?
Why are you doing this?
Is there something that is missing from the employer that they're not giving to nurses that is sufficient enough for them to execute their jobs and roles efficiently and in a quality manner that benefits the patients emotionally, psychologically, and physically? So there's so much going on. When you do research, you start asking yourself questions that, what is wrong in our setting in nursing? Is there something that nurses need? Do they need more money? Is it a monetary thing? Or is it job satisfaction that at some point you don't know if you're coming or going? You're just going to work. And there's nothing to look forward to. And is that the employer that needs to work on themselves? So that you can have the best of employees. Because I don't think, when you look at the private sector and public sector, it's different. I don't think they see the same things. Public sector is another story. Private sector is also another story. And I've noticed a lot of patients that will tell me, private was private is nice. The nurses in private are so nice. And I always question myself, what is wrong with public that private has and public doesn't have? Because when you hear complaints about rude nurses, it's always in the public sector.
Why?
You never see a person sleeping at net care or clinics or
is it the money?
Anywhere telling you that the nurses were rude.
Is it the money?
I don't know. I don't know. I wish I knew what exactly it is, but I don't think it's the money. I think it's the environment. I think it's the space, you know. I think it's the structure of private. How private runs their hospitals and how public runs their hospitals. So I don't think it's something that has to do with money. Because some salaries, when I look at nurses that work in private, they really get paid peanuts. They really get paid peanuts. But you find that public nurses they get paid more money, but the attitude is on another level.
Is it lack of accountability though from the public?
I think it's I don't know. I'm still yet to understand. Maybe I'm gonna do a study on it one day. I don't know. But I think there's something behind private and public. Because the private nurse, when you get feedback from patients, they'll never say the nurse had attitude. But go to public.
Or maybe it's because in private, for one to get fired, as soon as you lay a complaint to say nurse,
you get fired quickly.
You get fired quickly. So nurses behave.
No, but I don't think that is something that is gonna make you behave.
Because I have a friend, she was working somewhere in Middelburg.
Yeah.
She was like, she witnessed someone actually. Management came and said, "Take your bags and leave now." That's something that you're not gonna see in public.
Yeah, it doesn't happen in public.
You're
there for 40 years.
You're there for 40 years. Yeah.
You tell them when to get off every day. What I noticed is also there is a lot of comfort in public institutions. We're not monitored. Our managers are our friends, and we can tell managers where to get off.
Yeah.
My UM cannot tell me anything in public, or the matron is like, and then when. But there's this certain there's a respect. I was shocked when I worked in private, and I was just a training specialist, but the respect they give you when you're wearing epaulets and you walk into your unit, they stand up.
And that's one thing that as students we never. I used to fight that. Stand up for who? Stand up for who?
I used to fight that in like I didn't find the necessity of why should. But when I walked in, there was a unit I walked in, they stood up. That's when I knew this is not the same place I came from.
They respect hierarchy.
This is not where I was trained. It's even worse when you have bars. They worship the ground that you walk in. They respect hierarchy in private.
I actually did a ward round in netcare. I'm not even working in netcare.
They will stand.
Lavinia was admitted in netcare. I had knocked off from work, so I had to go see her. So while I'm still wearing uniform, after visiting time, as soon as I walked in, they stood up. The shift leader came to me, greeted me, and I asked her, I'm not even working there. I'm like, how many patients do you have? She's like 22. I'm like, okay, we're gonna do a word round. We're gonna start at the back. She was ready. We went. Here at netcare.
Yeah. That's what I'm saying.
They respect hierarchy.
Private is another climate. You can walk into any hospital wearing epaulets, they stand up. The moment that they see your bars, they already know. There's nobody who tells them. Nobody cares who you are. There's just that initial response that this person, we don't know who they are. There could be someone bigger. There could be someone coming here to monitor us. They give you the same respect. They'll stand up and say, "Good morning, sister. How are you?" I'm like, "Good, thanks. I'm good." I've never felt so powerful in my life until I walked down the corridors of a private hospital. I was like, "This is power." Yeah. You're walking, everyone greets you.
And that time, I'm with 6 bars. I'm changing the.
I'm like. I'm telling you, it is. So I'm still trying to understand that what is it that we can bring to the public sector that will make it equal to the private sector?
I think it's accountability. Yeah, if you can bring out this sense of if you fail to perform according to your scope of practice, you're out. You'll be, dude. We had to run a research this other time. We had to run a research this other time. We are busy compressing after compressions. And I asked this other lady, she has an ENA. And I was like, come, do compressions? She was like, no.
I
don't. Why? She's like, I don't know how to. I'm like, what kind of a nurse are you that you do not know how to do basic compressions?
Yeah.
Where did you study?
And that's another thing that I picked up is in government, in public, there's not much of training that is done, and for continuous training. In private, if you don't have BLS, they make sure that you're going to get BLS. There's no way you're not going to get BLS. BLS is so important. It is, you need to be BLS trained. A company can invest just to train everyone on BLS. Even if it's 100,000, they're going to take out that money so that everyone is trained on BLS. Because those are risky people. Because BLS equip you with the confidence. You know, once you've done a BLS training, your mindset changes. You now know what's your first response when there's an emergency. Because I think that is important. When you know the first step and understand that during an emergency, your most important thing is to check the pulse, check the breathing, check if this person is conscious, and immediately start those chest compressions. That is so important. And at this point with the BLS rules that we have is compressions are so important than any other thing. You need to start those compressions because we need that person alive. And once you know that high quality CPR, you can save a life.
You can save a life.
If you know what that is exactly. Because sometimes you can be hopping on that chest, but you need to know the depth. At what depth are you giving those compressions? At what pace are you giving it? At what rate are you giving it? Is it high quality?
Have you had a sister run away from you? Run away during a recess?
I did a lot of mock resources. It was so annoying. You come in, you ring the emergency bell, and everyone just looks at you, disappears, not even looks at you. It's only units that are ready for emergencies that you don't even bother. I never bother to do mock resources in ICU or in trauma. Because when you do the mock resource, because we tell what happens is if I go into the hospital and I'm doing my mock resources for the day, I have to tell the trauma doctors that I'm doing a mock resource. So any time of the day, because when they press the alarm button, it goes to casualty, it goes to ICU, so it notifies every doctor to come. So we check for the time response, how many seconds or how many minutes did everyone come to play. So you are allowed, when you're doing a mock resource, to notify the whole hospital that there's a resource. You just come in and you like resource.
So how it works with you guys, that let's say on a real resource, we're working in Ward 2, and then you have a resource, every doctor is gonna come.
Yes, in private it's like that.
Whoa!
Trauma doctors need to be there, ICU doctors need to be there. So when you ring the bell, it's ringing in trauma and in ICU. So the moment it rings, all the doctors that are assigned for the day, they have to run to that unit.
Dude, when I'm working in Ward 2, and we have a Ward 2 resource, you can actually see a doctor coming in. If they are not working in that unit, they can actually leave.
Are you serious?
I'm telling you.
No,
many times we call the doctor, say, no, but we're having a research. Like, no, call the doctor for this patient.
No, in private it's not like that.
Wow.
There's 2 departments that need to be notified immediately when any bell is rang from any ward. The moment you start in compressions, trauma doctors need to be ready, ICU doctors need to be ready. They need to be going there to deal with that emergency. It needs them. They are needed. That is why, because sometimes you might need intubation. You need to be intubated immediately. And so it's very important for the nurses to know how to do compressions, because that's the first thing that we want to find them. If the doctors come in, that's the first thing they want to see you doing, because we want to see how many cycles have you done. How far is this person? But 2 minutes, it doesn't finish before they come. They all come. 2 minutes, they're there.
Whoa, this is new to me.
No, it's resources.
And it's beautiful.
It's resources. That is what private patients are paying for. That's resources. That is how efficient their systems are. I'm sure Netcare is on another level.
Wow, this is beautiful. It's beautiful. If they notify so many dude, we would do the research with our, if we are in renal, I'm making an example. If you're in renal, we'll do recess with the renal intern and reg and consultant if he's there. Right? And then once we've stabilized the patient, then they can call ICU. For an ICU consult, if we need an ICU bed, or
no, the ICU consults are there during resource in private. The moment you say resource and press the red button, it notifies ICU and trauma. Everyone comes.
Sure. Speaking about injuries, right? I love this. I want to read you something. This was not part of our thing, but I think I should read this to you and tell me that. It's a poem that I wrote. Maybe you'll tell me that I'm morally injured, and I need counseling.
Maybe you are.
Right, this is part of my book that I'm writing. It's called The Chronicles of a Night Shift Nurse. Because I think I have got a lot of. I'm writing a book, right?
You guys have time. Yeah. If you're not typing in verses, you need to be writing a book.
Exactly.
Keeping yourself busy.
That's it. This year I said I don't want school, so.
I always ask people that if you're not at school, not writing something or doing something, what is keeping you stimulated?
So it's a I don't know if it's a poem or what, but you'll determine. I wrote this immediately after a recess.
Wow.
Titled "We All Cried."
Okay.
We all cried. It goes, she dropped dead as she was explaining a story that had everyone in the cubicle interested. How can one take our breaths away through laughter while she was about to take her last breath? A sudden change in mood overwhelmed us as we did the recess in silence. The mini cracks from her ribs accompanied each compression and grew louder as it came close to 30. No spontaneous rise and fall of the chest. With those pupils dilated, can she even see us trying to reach that 30? Her image faded and got replaced with my mom's. Each compression started feeling heavier and harder. Can she just wake up? One of the admitted started mumbling in prayer, and the other covered herself with a blanket. I continued counting, longing for that 2 breaths break that separates each cycle. Can she please wake up? Each compression motivated with a prayer and a reason to wake up. 1. How can you just go so abruptly? 2. Minutes has passed with no pulse. 3. Like a tree chopped down with green leaves, leaving chipping birds stranded, you fall. 4. It took 4 men to get you to bed. It's the 4th cycle and I'm drained. 5. You are leaving 5 of your fellow admitted here. Wake up. They are all crying. Wake up. 6 days since you came here and you completed a cubicle of 6. If you go now, how will I comfort the left behind? 7. Heaven can wait. Please, ma, don't. 8. Staff members watching and praying for your pulse. 9. I'm hearing this ribs crack. 9. This normal saline has stopped running. 10. Take a deep breath and show me a sign of life. 11. What am I to say to your kids? 12. Why is everyone so silent? 13. My knees are shaking, my glasses are falling. 14. My arms are sore, wake up. 15. Your eyes are fixed to the ceiling. 16. Wake up. 17. God, hear my prayer, please make her wake up. 18. I'm too young for this. 19. I need counseling. 20. I'm not okay. 21. This profession is not for me. 22. Wake up.
Wow.
23. Your HGT reading was too high. 24. Ampules of adrenaline later, still nothing. 25. Days since I last saw a dead body. 26. No last words, nothing. That's what scares me most. 27. % of oxygen saturation. 28. My age this year and I'm dealing with death. 29. I hope the last one does it. 30. Beats per minute. That's the last reading I'm seeing. That's it. The daughter asked for a BI and I knew it. What's the time of death? One nurse asked. Too soon, I replied. Last officers. There is a distinct sense that confirms death that I can't clearly describe. One needs to experience it to know it. It is like that of heated metal mixed with perspiration, if that even makes sense. The crying grew louder as we moved outside the cubicle. No need to be discreet, as every present body could feel the departure. As the whole team left the room, I became the 6th, and we wept. 1 nurse, 5 patients, all crying. What do you say? How do you comfort? Fuck, I'm human after all. Wrapped like a Christmas present discovered in January, you lay there. I stared for a long minute in disbelief. You didn't even move. Lifeless you remained. I'm speechless. I'm drained. After all this work, you still decided to go. Your daughter came and asked what had happened. I couldn't utter any word. She burst into tears, leaning into my epaulets. I held her tight in support as she let it all out. She asked what was the last thing you said. I don't remember, but she cracked a joke that got us all laughing. And minutes later, she was out of breath, and we all cried. Nursing care continues.
Interesting.
So I drafted this immediately after a recess.
I need this. I need to read to my students when I do my training, my BLS trainings. Yeah.
Am I injured?
You could be. You observed what? I felt resource. That was you fighting with God. You know, resources are always that battle when you fight with God and you're like, we know science is gonna work, and the journey ends there. Yeah. The journey ends there. I think that's what we need to do as professionals. We need to understand that holistic nursing that we keep on teaching each other, you nurse the body, the mind, and the spirit. The spirit will lose. And we don't have control of the spirit, except for the physical. But the spirit, when the spirit is lost, it's lost. The physical won't do anything. It is what it is.
Yeah.
That is the sad part about nursing. That is what people don't see. The things that we go through and nobody sees it. It's like, yeah.
Maybe in closing, what would you like the public to know about nurses?
Nurses are very intelligent people. They're people with dreams, emotions, needs, and they also have rights. I think that's where patients don't get it. I don't know how many times patients will tell you that I pay your salary. I'm a taxpayer. We're humans. This is also a job for us, you know, and it's a service, yes, but we're also human. We also have families, and there's no nurse that wakes up in the morning to go and kill a patient. No one wakes up in the morning to literally go and inflict harm on a patient. And we go through so much training to get to where we are. And I think that training needs to be respected because we are professionals in our own right, and that training proves it. And we are also humans. I think that's where people forget that we should not feel, we should not have emotions of anger. We have that. We go through a lot. And I remember during COVID, someone even said on Twitter, but nobody asked nurses to do nursing. Yeah, nobody asked me to do nursing. Even if you knew what you were going to encounter or you knew what you did not going to encounter, but at the end of the day, just like any other job, it has its challenges. And that's it. We chose to be here and we're going to stay stronger. But also we have rights. And that's where people don't get it, that we have rights.
But one of the political leaders at some point, apparently he said, if nurses decide to protest, we can get anyone from the street.
Which one? They need to give me that one person that they're going to get from the streets who can nurse a patient holistically and understand the nursing theories and put them together, put psychology together, psychology theories, Sigmund Freud, put together social sciences, sociological imagination, the human anatomy in the body. I want that person to come and identify to me if there's a fracture, which bone it is. If they can take anyone from the street, then everyone can identify where the tibia and the fibula is and where the scapula is. That is what they are communicating. If you can take anyone from the street to become a nurse, that is why I always tell people that In nursing, you get trained. You get equipped with knowledge to go and learn and understand that anatomy of that body and treat it safely at the highest of quality. Not anyone can be a nurse. It's not. The same applies. You can't wake up and be an accountant. It has its people. You can't wake up and be an engineer. That's the same rule everywhere. Can't be like, if anyone can be an engineer, then we're all going to be engineers. There has to be engineers, there has to be doctors, there has to be nurses, there has to be any other profession, but it has its people. So you can't pick up anyone to be an engineer in the street. You need to learn that. You need to go to school for that. You need to learn that skill.
It is a profession.
It is a profession, and it's right. That is why there is training, intense training.
It's not a calling.
It's not a calling.
I'm saying nursing is not
it's not. I was not called. I chose a career path, and I came into it with the mindset that I'm going to be trained, skilled, and be equipped with the right knowledge to serve that patient. And if the war comes between the patient and death, I would have lost. It's fine. We need to move on. We need to be counseled and gear up to the next level of growth. It is what it is. We wouldn't go to school if nursing was a calling. Why do you teach them anatomy and physiology? Why do we learn sociology? Why do we learn psychology?
Because you should just spiritually diffuse.
Yeah, and it's when you can nurse your grandmother at home. Then you can be a nurse any day. But you can't nurse what you don't know. Nursing is a science. It needs physics. It needs psychology. So you need a lot of information and knowledge to combine that IV therapy, that it needs the law of gravity for it to come down. You're not going to put it next to the patient for it to actually transfuse into the patient. It needs to be up. That's gravity. That's physics. You need to understand the ions that are inside that vacuoliter that you're giving that person. How is it going to go into the cell, intracellular level, and how is it going to benefit that cell itself? You give the wrong thing, it backfires. So you'll never nurse a patient if you don't know what water is made up of. You'll never nurse a patient if you don't even know that oxygen is a drug. You can't. I mean, I respect my training, and I don't believe anyone can be a nurse. I do not.
Only the called.
Which called?
Or only the trained.
Only the trained. Only the trained. Let us respect nursing is a profession, and it stands. The hospital is nothing without a nurse. I'm yet to see which career can overtake nursing. I'm yet to see that.
Do you love nursing?
I do. It has made me to be who I am. I think every day I love it. And that is why I'm developing myself to go there to make it better. If I can be in a certain place that can influence more, I can. That is why my growth is always about what can I do to make nursing better? What can I do to make nursing education better? What can I say to the student that will make them think differently about nursing? That will make them see what is important in nursing. How important this career is.
You must invite me to be a guest lecturer.
When we open, most definitely.
Yeah.
Kwanele, thank you very much for this. I really enjoyed our me and you can talk for. Imagine I made you talk for 3 hours and I haven't even offered you coffee.
And we can talk for
we can talk. No, but thank you very much for having this sit down. And I know, not that I think, I know people will benefit a lot from our conversation. By the time I put this up, it will be, I don't know when, because to edit it 3 hours or 4 hours long.
Make it a 1 hour
and make thing. It now I'll cut it into part 1, part 2, part 3, or something like that. But yeah. I'm happy, when we are trying this out. I don't know how the quality of the video will come out. We are hoping that things will be as we want them to be. But I'm happy above everything else. I'm happy of the content that we unpacked. I'm happy about the knowledge that you have dropped and your perspective in all the topics that we've covered.
Thank you for having me. And I hope this changes someone who wants to do nursing.
Definitely.
Never.